Welcome to This Week in Health IT Influence, where we discuss the influence of technology on healthcare with the people who are making it happen. We are the fastest growing podcast in the health IT space. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics. Does your health system need to do more with less? We've been in your shoes. Let's talk. Visit healthlyrics.com to schedule your free consultation. If you're enjoying this show and want to support our mission to develop the next generation of health IT leaders, there's 5 really easy things you can do. 1, you can share it with a peer. Love that. Interact with our social media content that's out there. You could just follow us on the social media accounts that we have, LinkedIn, Twitter, YouTube. Send me feedback, bill@thisweekinhealthit.com. Love your feedback, recommendations on stories to follow, recommendations on guests to have on the show, questions, comments, everything. It's all really appreciated. And you can visit our website and subscribe to the newsletter. All of it helps. Really appreciate all your support so far. Today I'm excited. We were able to, while we were in Philadelphia, visit with a couple of systems and a couple of great startups. And this is one of the ones I'm really excited about, Quil Health. And we sat down with the CEO, one of my favorite people in healthcare, Carina. A great show, great conversation. Hope you enjoy. So today I am in beautiful Philadelphia.
Hot and sticky Philadelphia.
It's amazing. You walk around outside.
Yes.
And but Carina Edwards, CEO of Quil Health, startup organization. I'm looking forward to getting into that. But Philadelphia, we're in Philadelphia.
We are.
It's amazing to me. So this is the second podcast I've done live in Philadelphia. I'd like to do this more as I go to cities. It's kind of fun to just, but there's a startup scene here.
There absolutely is a startup scene here. I think what you're seeing is this space in Philly has been known for biotech for a long time. And that is bridging, right? I think the worlds in healthcare, and we'll talk about today in the podcast, the worlds in healthcare are the walls are falling down. And so you're seeing these startups emerge, you're seeing bridging the gap in a lot of technology areas that are coming out of the passion and the amazing academic institutions that are based in Philly.
Well, that's what I was going to, so Philadelphia has 5 academic medical centers, within a stone's throw of this building. I can't think of another city that has 5 academic medical centers that are competing.
Correct.
It's, I don't know if that's a benefit or, it's throwing off a lot of people. Great education. You have Jefferson down the street, Penn's like right over here
and
somewhere.
The affordability of the city with the access that it gives is amazing. You know, as a Boston transplant, I love Boston. I was raised in New York, so I'm always going to be a New York City fan first. It's hard for me being in Eagles territory. I'll be on the record to say that. A little tough. But
you're wearing your green, which is good.
That was not actually intended. I'm a New York Giants fan through and through. I'll put that out there.
Oh, really?
And we're having the worst season ever, so hey.
But you got Saquon Barkley. He's phenomenal.
He's phenomenal. So it's been great, but it's an affordable city. It's a foodie city. It's really transforming, and a lot of New Yorkers are moving to Philly.
Yeah, the two things I love about Philly. One is people say, what's your favorite restaurant in Philly? And I'll say the street carts. You can eat any ethnic food across the country from a street cart here.
But the foodie scene here, the James Beard Award-winning chefs that are here, the Michelin stars we're getting, it's amazing.
Well, Vetri's here.
Vetri's, Zahav, yep.
It's phenomenal.
All Steven Star restaurants.
Yeah, every now and then I come into Philly with a foodie and you go to these back streets and you think there can't possibly be a star restaurant here, and it feels like you just walked into somebody's home.
Yeah.
In some cases. It's amazing. The other thing about Philly, and then we'll get to the podcast, but
okay.
So I'm setting up for the last podcast, and the AV guys are in the room, and I said, hey, tough, the Sixers losing, and they said, yeah. I said, it's been a long time for you guys. They said, oh yeah, it's 1984. I thought they were going to say the exact time, and they said, oh no, it was 1984. I said, oh yeah, that was Julius Erving and Daryl Dawkins. They go, oh no, it wasn't Dawkins. They then proceeded to rattle off all 10 guys that were on the team, like Maurice Cheeks. I go through people, I'm like, oh my gosh, you guys are
It's a sports town.
It is a sports town.
It is just like Boston in that regard, right? It is a sports town.
Yes, but to rattle off the team from 1984.
They're passionate.
They are passionate, and nothing more so than their Eagles. It's kind of crazy. But let's get to you. I usually start with a pretty open-ended question, which is, how did we get here? Last time we talked, we were in Chicago at I think it was the last time we talked, it was in Chicago at the Becker's Conference.
Yep.
And you're with Imprivata.
Yep.
Pretty happy. Things are going well.
Things are going
great. And now you're a CEO for a really interesting startup, really interesting partnership,
Yeah.
well-funded startup. Give us a little of the story.
Yeah, so the story, it was one of those things where, I got a few phone calls. I pushed them to friends, and then they kept on coming back. And so I said, all right, I'll pull the string a little bit. And what I found was a really amazing opportunity. So when I was at Imprivata, what I was the most proud of was my 7 years spent there. We rose the NPS score up from 16 to 60. We actually went from customer retention 92% to 99%, and we scaled the organization going public and then going private. And so I credit that organization is doing amazing. And I also had built an organization where I had number twos that could then take on my role.
Yeah.
So it seemed to be an interesting time when I got this opportunity. What's unique about this, Quil is the joint venture between Comcast, NBC Universal, and Independence Blue Cross, both Philly-based. I call them my parent organizations, are right across the street. When this was first stood up in April 2018, it was called 1819 because Independence is on 19th Street and Comcast is on 18th Street, and so 1819 was formed. We got the name Quil last November, so that the group got together. They got branding done, they built a tech stack, and so what we're here to do is organize and navigate your health life. And there's a big gap in everything going on with tech right now, where that being able to answer that question, what happens next? What do I do next? And so that's where we're focused. It's a really broad mission and vision. We're starting with episodic journeys of care to really make sure that patients and the teams that support them and their loved ones just know how to answer that question and can navigate appropriately.
So it's a care navigation play? Is that
It is
accurate?
a patient health companion and a caregiver companion tool set.
So based on digital technologies, tech stack, and
Oh yeah, the tech stack. So it's clinical content, it's lifestyle content, it's patient interactivity through quizzes and surveys, etc. It's nudges, it's wearable integration. And so when we think about what's unique here, it's not just the funding mechanism, but it's also the distribution mechanism. So we are an app, we're a website, and we're also on the television. And so there are 85 million Comcast viewers every night. And so we now have a Quil X1 app on the Xfinity platform, and now we can get that curated playlist for that individual. If I need to see these 4 videos before getting ready for my hip replacement, I can now bring in my family to watch them with me, or my support team to watch them with me, because those aren't PHI related things. That's like, how do I set up my home? How do I get organized? Can I drive? It's answering all those questions. When you learn about, hey, your hip's coming out, you're not thinking in that 20 minutes of the doc. And so it's bridging them through all of that. So we have to do this big wave right now to get the lights to go back on.
Oh, we do?
We do.
We have to do this thing?
Hold, please.
It's a beautiful thing about a podcast. People are going to be like, what were they doing?
What were they doing?
But they could
were
always go to the
running around.
YouTube channel and see us running around with our hands up so that the lights go back
The
on.
lights go back on.
So you're picking certain things like orthopedics at this point. Care navigation is such an interesting play. Traditionally you have phone care navigation or paper-based care navigation.
Paper,
and by phone, I mean like analog phone.
Yep.
Hey, what should I do next? Paper, we still get the mail where people are saying, here's some stuff. Get a whole bunch of papers handed to people when they walk out, which are almost indecipherable to the average layman.
I love the photocopied 17 times, so now it's not really on the page.
Yeah.
It's like that little side page, and here's your patient packet, and here you go.
What was I supposed to do? Then you have the smartphone. You have digital navigation, which, to be honest, we're seeing a fair number, but now you're saying set-top box.
Set-top box, also web. When you start thinking about this, you have to have an answer to meet people where they are. We're in pilot right now at one of the major academic medical centers right around us, and what's amazing is the eligible patient population, and I want that to be 100%, and I don't want to limit, you have a flip phone so you can't participate, right? So right now I have an offering that is 100% eligible because they can get the same content and that same workflow, whether it's on their television, or whether it's on the web, or whether it's on the phone. And so we can engage them in different ways, and we can also just bring it to one of the fun, unique things here, the NBC Universal tie-ins. And the content, medical content, medical literature have been evidence-based for a very long time, even back in my Zinc days, I think when we first met years and years ago, right? Order sets were evidence-based, but everybody puts them into a different workflow. And so bridging that gap between letting a patient go into a system with evidence-based content and teaching them what to do, but also in the workflow of that institution to make sure it navigates their way.
Right.
And that's a bridge to bring interesting content in short snippet, light, fun. I mean, think about it. We have Al Roker that does our welcome video. We have some fun, right? Some fun folks here in Access that
they're familiar. It's comfortable. It's
and it's compelling.
Yeah. Well, one of the things for care navigation that we were trying to do for a pilot was start to record the physician talking to you while you're in the office.
Yes.
And I'm now caring for 87-year-old father-in-law who's moved in with us and those kind of things. And part of the challenge was when he was in Pennsylvania and we're in California, and he would call us up and we'd say, how did the visit go? And he'd say, good, and he wouldn't remember the medication, he wouldn't remember the timeline. It's one of the reasons he moved in with us, because it was just too hard to navigate. But that's one of the things, just one of the many ways. What does the future of care navigation look like? I mean, is it? So
I actually believe, right, that there will be a marketplace, right? We will not be the only. And now I think with 21st Century Cures Act and TEFCA going to legislation, we have the right as patients to make our data portable, right? And so that's step one. And so now that I can get, with Blue Button paving the way, I can bring my data into an app when I consent.
Yeah.
I can also consent to share my information with others. And now you have a digital ecosystem with you and your support team. Some people call them caregivers, whatever name you want. These are not the clinical professionals that care for you. These are your niece, your nephew, the friend that's going to take you to the appointment. Now I can see with those feeds, I can see schedules, I can see medications, I can see claims data, and from that I can share with you a comprehensive recommendation of what to do next, not just on the journey you're on. So in the current pilot that we have now, we have some patients that are going in for a hip replacement. Great, full stop. Now you add to that though, their BMI is 40 and they're a smoker. So before we get them on the table, can we also get them to potentially change some behaviors in the next 7 to 8 weeks that will make them better for that encounter and get to the better outcome? And I think finally our incentives are aligned, because now with value-based bundles, right, the risk lies with making sure that patient is well. If they get readmitted, then I hold the cost for that. So what can I do to drive adherence, education, and really then get through this journey together and get them to the healthiest version of themselves? Because it's not about everyone needs to go climb a mountain. And so this has to be innately personal, right? When you think about the content, I had a friend who was going through a hip journey, so I say, please use Quil, give it a shot, give me a ton of feedback. And his best feedback was, stop showing me 80-year-old women in walkers. I'm going to be back on the golf course soon. And I said, fair point. And so I turned to the team and I said, what can we do for customization and personalization? And so within a month, we've now tagged all of the content, and we've actually done a demographic tag. And so literally I can present to you based on your goals. What are you looking to achieve? Are you looking to play with your grandkids? Are you looking to run a 5K? Are you looking to get back to a marathoner? Everyone has a place they want to start and where they want to go.
How long have you been CEO?
90 days.
90 days. Okay, so
actually 100. I think
we'll see. Your tech team might watch this later.
Yeah.
So I'm going to drill into this, because the question becomes: all right, is it B2B, B2C?
Right now it's B2B. Eventually we might be B2C.
Okay, so where do you get your content? Do you get your content from third parties, or do you get it from the partner systems that you're partnering with, who are potentially the orthopedic surgeons, the orthopedic department? Okay, so you're getting it from all the above. Then how do you determine what actually goes out there? Do you have clinicians on staff, or are you using algorithms to try to figure out what's...
Yeah, so we have clinicians on staff, and we also have a clinical advisory board. But more importantly, the way these come together, right? So like I said earlier, there's evidence-based journeys, full stop.
Yeah.
And now you bring them to an academic institution. and they say, okay, well, you know what, I want to customize the front end of that. I want to change this language here. I want to put in 5 other steps that are unique to us. And so on the tech stack perspective, we have a CMS, we have a workflow engine, and we have multi-tenant. And so now, literally, when the individual or care team come in, they put in their code and they get to that institution's flow, the way they want to see it. So now we're bridging that gap, I think, between the battle of the brands, right? And then also care, because each of these institutions are world renowned in certain things. And so they want to showcase to the individual and the patient that, wow, this is a journey that you're not going to get anywhere else.
Yeah, that's interesting. You know, I'm trying to figure out where I want to go next in this, because it's interesting. So talking to Dr. Klasko earlier this week, he said, you know, there's $1 trillion market for healthcare transformation. Healthcare will not be delivered the same in 5 to 10 years. Now, he is one of the more forward-thinking, and I found that the more forward-thinking, typically their dates are wrong. You know, it's like that we're going to change healthcare in 3 years, and you're like, 3 times what? 3 times 2, 3 times. So is it 6 years? Is it 9 years? But you're right in the center of this. So TEFCA, 21st Century Cures. You have the work of Secretary Azar, and they're all saying, okay, push that data out.
Sure.
But that's still a challenge to. I mean, there's a whole. You want to get that claims data, and supposedly based on what's being proposed, you're going to get that claims data. We do have Blue Button.
Yep, we
so
do.
For a certain population, you can get that data.
Correct.
But what is it?
Well, I had this discussion with someone the other day. So the one thing I will say is, be careful with you're going to get that data, right? Because I don't think any of the digital health apps want the onslaught of all of the data. I believe there are things that we can leverage that can help somebody monitor a condition or monitor a journey or make it personal to them. That is not the entire potential data set of every single blood pressure reading you had during your 15-day.
Which is good, because you're not going to get it.
Correct. and so I think when you go through this process, you have to decide what's meaningful, what can drive adherence, and what could actually be patient self-reported or wearable, or make it easy, right?
But here's what's not sustainable. If every time you go into a new market,
sure.
So you're in pilot with a couple of health systems. Yep. But if every health system you go to, you got to, look at their data set and fix it and bring it across and integrate it. So you're in the Philadelphia market. Are you in other markets right now, or?
We are right now in Philadelphia.
In Philadelphia.
Yes.
All right. So you go to
18 months old.
You go to New York. You go to New York
Sure.
Presby, and they go, well, hey, we're Epic. You're in an Epic shop, or you're in a Cerner shop.
Sure.
We'll connect up, no problem. Hey, we'll use Fire. But once you get that data, you're looking at it going, okay, we got to do something here. We got to massage it. We got to whatever to get it to be used. I know that, you just rewind 8 years ago when I was trying to do this.
Yep.
The difficulty level was like a 10 out of 10. It was really hard to do. Is it still hard, or is Fire, is all this stuff helpful, or is it still confusing?
It's very helpful. I think what it's doing is it's giving us a standard. It's not, to your point, it's not every single piece of data. Blue Button also limited it down to specific data types, and those are done in a pretty consistent way, because the good news is, right, this is now in legislation, I believe, for 2020. Don't quote me on that, but I believe it goes into penalty effect somewhere in the 2020 timeframe.
Right.
So I think healthcare institutions are getting their ducks in a row to say, okay, a great example I had with a conversation with the CIO. He said, it's a double Citrix hop to get into my I think he's using Cerner, my Cerner instance. Okay, so Cerner has to kind of come to the table here and say, hey, based on the new laws, we have to publish this API. This API has to be attainable and has to basically give this subset of data,
right.
20 elements. Don't make it up. And from there, it's an industry standard. So now a patient is consenting for those 20 elements. When that comes, clearly you have to protect that PHI. So clearly we are looking at all the HIPAA laws and regulations. But this is where you think through, it's not all of it, because there's so much consumer and patient self-reported and care support team reported. It's like when you go to the doctor and they say, how many glasses of wine do you drink in a week?
Which week?
2.
Yeah, 2. 1.
2 a day. 2 every 5 hours. And so it's when you start getting their behavior data mixed in, so the EHRs aren't the holy grail, the claims data is not the holy grail, the wearables aren't the holy grail. It's when you put all of this together in your consumer life and bring it to bear to help you figure out what happens.
Why do we? All right. Why do we need partners to do this? Why can't health systems do this by themselves? I can answer that question if you'd like me.
Please.
Your
perspective is a lot better than mine.
Well, it's interesting because you have this great team. I wish I could scan this whole thing right now, but you have this great team of really smart developers who are really focused in on a set of technologies.
Yes.
So they're going to be able to patch that when iOS is going to have a new version every year, and you're going to have to. There's going to be a ton of tech debt immediately on the application, but this team knows how to do it.
Check.
All right, so Providence has put 200 people in Seattle to do this, but I can't name another health system that has even remotely close to 200 people who are going to be able to keep the versioning correct and all this other stuff that goes on. So, I mean, that's one of the reasons. It's just tech debt.
I think that's one of the reasons, but I think the other reason too is you're bringing different capabilities to bear. In our unique situation, right, I actually have some folks on the team that came from the payer side of the world.
Yeah.
I have some folks on the team that are still employed by NBC Universal. I have some folks on the team that, right, and so when you start thinking about...
What does the NBC Universal... That's unique. So what would that bring to obviously access to the set-top boxes? Well, that's Comcast.
No, that's Comcast. So NBC Universal brings engagement. So think about it, right? They have their theme parks, they have movies, they have television, and whether the television is delivered on the Comcast box or Hulu or Prime or whatever, Universal is.
So it's influence. You can influence healthcare for a pretty significant population.
I'll say it differently. It's actually, we know how to engage people because we build the content they engage with every night. So it's taking a content play here and making it engaging content.
Fascinating. What does success for Quil look like?
I think like any digital health enterprise, I just left a board meeting. It's a series of milestones that get us to viability and scale. And so how do we make sure that as we go out there, it's not just about the numbers. It's never been about the numbers for me. This is a value play. If I can't deliver value, then we shouldn't be in business. It's one of those pieces where when you look at all of the tech startups that are out there in the landscape, a lot of them sometimes are doing tech for tech's sake. This isn't tech for tech's sake. This is saying, okay, there's someone trying to navigate. There's a system moving from fee-for-service to value. That person trying to navigate this is at risk because they don't know how to navigate it correctly, and then the person holding the value there and the risk there is also now incented. So finally, data is accessible, incentives are aligned, and we're just trying to serve up value for the patient and the caregiver. What do I do? How do I do it? Where do I go? Ask all those questions that the nurse navigators answer every day of the week. And get that done in a way, and if they have questions, they can chat. AI chatbots have come a long way, right? We can answer a lot of the things that happen every day, and there's value in that because now you're taking a more efficient approach, you're driving better patient adherence, and the holy grail is right information, right time, right place, you're going to get to the best outcome.
Right,
So,
plus 80-20, I mean, only 20% of health outcomes are related to research and the hospitals and the stuff that they're doing. 80% is social determinants. You have a way to reach. I keep coming back to this.
It's a different reach, yeah.
It's a different. The set-top box is interesting to me. I don't know. It would be interesting. One of the things we're missing, I think, in this space is, we have research on just about everything in healthcare, but not digital. The effectiveness of digital tools. In order to make that. So my encouragement to you as a CEO is as soon as you can get those, those published studies that say, hey, this percentage, this is how we move the needle, and anyone else I'm talking to in your space, I'm saying the same thing, because I think there's still a host of people in healthcare that are saying, hey, prove to me that this is going to move the needle.
Well, and I think that goes back to, you have to go, I think, beyond some of the wellness pieces, right? Because I think what the self-insured employers have been seeing as a whole is the wellness initiative is great, but they're having the same problem the health system CIOs are, right? They're looking at a tool set that has, 75 apps that they need to get to their employee base. How do you start going beyond that and thinking, hey, I've jumped into this, and now I'm going through a pathway, and so that's why we're starting there. Because yes, of course we want the population to get better and be well.
Yeah.
but it's got to start a little bit earlier so they get comfortable with the new tooling and the exchange.
Will this be a tool that's used within the employee population of Comcast, NBC Universal, and whatnot, sort of like a Amazon, Berkshire, whatever plan?
This is a tool that we will absolutely pilot with both populations, with Comcast as well as independents. So yeah, we're working through the definition of those pilots and when we're going to start them. But
now we got to wave our hands again.
No, I don't think it's going to work because we have to go all the way over to the light. So hold, please.
It's all good. No, we'll keep them all in. the benefits of
the eco-friendly. So clearly, we're not waving our hands enough in this podcast.
Yes, have to get more passionate about the topic. So NBC Universal and Amazon, you are going to use it with your populations.
We are, yeah, and I wouldn't. I don't know what Haven's doing. I don't. So I don't know if we are.
Yeah, I know. If I knew what Haven was doing, that would be a news story in and of itself. I think they're trying to figure it out at this point. They're doing a lot of research.
That's great.
Which is sort of the hallmark of a tool.
I think all of the major players are getting into this. I think so. This is not. These are proof points that there's a need and there's a market, and how do we serve that need and deliver value?
Let's get back to your journey. I sort of
Sure.
wanted to do that. So you have two things going on here: female CEO and well-funded startup. These are not common terms that we hear, but I want to talk about the being a female CEO. It's not common. It probably should be more common. What would you say to the next generation of female leaders to say, let's how would we make this more common?
Yeah, it's a great question. I think, first and foremost, the last study had that Rock Health published, and it was mid-2018, and I think McKinsey just did an update, or one of the big consulting companies. 10 to 13% of digital health CEOs are women. And I think 30% are diverse candidates. And so I think the whole notion of we have to go back to the studies that show building diverse teams produces better business outcomes. And that's the thing we all have to look at. And so there's an organization, parity.org. We just took the Parity Pledge. And all it's asking everyone to do is, how do you get a slate of diverse candidates for every job you post? And
Right.
That's something that's easy to do, but I will tell you the industry isn't wired that way. I've done some hiring here in my first 100 days, and it was nothing against the recruiting firm. I love them. I've done business with them for a long time. But what was interesting to me with this new lens, when I was presented with the list of here's the top 20 candidates, it was not a diverse candidate set. So I set them off to get me a panel of full diverse candidates, and we will find the best person for the job. This is not a quota-based system. We chatted about that earlier.
So was that hard for them to do?
It took them, it probably was a little harder, but they produced a great list, and it was a direction they hadn't received from others. And so I think what we can all do as leaders is we can ask the people that recruit for us, whether it's our own consultants, our own folks, just make sure you're looking at a diverse slate. Because it's eye-opening when you start getting, I'm looking at my diverse slate also is non-healthcare, right? And so there's all different stances for diversity that we just have to think through.
That's interesting. Outside healthcare. And diversity in all areas, because diversity of thought is good when you're trying to solve problems. This is why we have liberal arts educations, right? So you get all this diverse thought, and it helps you to solve problems. And
the data shows it. All the studies showed 50-50 is the best outcome financially for businesses. So this shouldn't be an argument that we're not convinced about anymore.
But not a quota system. You're not saying,
not a quota
okay,
system.
let's...
Nope. I think the best person should get the job.
So Apple has increased, one of their plays to increase diversity, which is really interesting, is they've taken college education off of a bunch of their jobs.
Oh, yeah.
And the reason is because not everybody has the economic background and the ability to pay for $200,000 to go to a college. But they have problem solving skills and whatnot. Yeah. They can actually learn at Apple how to be a very effective, how to be a effective leader. What kind of things do you think is going to help to build diversity within health IT?
There's a bunch of I think initiatives going on, especially with the younger audiences, right? Getting robotics camps in the summer, getting them involved in STEM earlier, way earlier, like in the mid-school, high school years. But there's also, for those that don't think college is a path for them, there's a bunch of great tech schools that are teaching mobile app development, web development, and these are skills that, if you're a creative, if you've come from an arts degree, I have a few folks on my team that don't have degrees, but they were artists and they're UX designers, and they look at the world so differently, and they bring such a perspective of thought. They're like, oh, I never thought about that, because they study human nature. And these are skills that come in, and they just make these aha moments that I think are priceless. So I would say, as you're looking to build out your teams, I like the non-traditional routes. There are a lot of places you can find great talent that's untapped.
So I like to brainstorm a little bit with entrepreneurs. So you're in the space, you're moving around, you're seeing things. Let's assume I'm going to do a new startup. What spaces are untapped in the digital space that as you're sort of out there, you're going, man, I wish somebody would fill that spot, or something would sort of pop up.
That's a really good question. Do you have an idea yet? As I think about this one?
I have a bunch of ideas.
Yeah.
Because I keep doing these interviews and asking really smart people. It's interesting because there's a lot of different spaces. There's the engagement space. And
can somebody just get the video conferencing in conference rooms to work on just like the most basic level? Like, I think about the things I struggle with. I
just had that conversation with Michigan Medicine CIO, and I said, what's one of the biggest challenges? He goes, video conferencing in the room. You know what the biggest problem with that is? It doesn't report into IT most times. It's into facilities. And you're like, why is that into facilities?
I have no idea.
Well, because they build the building, and when they build the building, a majority of that stuff gets bought and put into a room, and then they say, here goes. And then for whatever reason, they want to own it.
Well, so I was just a little...
I know it's tongue in cheek, but it's
so
true. Every healthcare organization you go into.
For 7-10 minutes of every meeting, it's hold on, can't get the X working, and it's not just one vendor; it's all of them collectively.
Yeah.
So that can be. But I actually, when I look at our space, there's really interesting change happening with new care models, with new social determinants, with new neighborhood-based approaches. And so as more consumer information comes in, I do think there's going to be some killer apps that come out dealing with the neighborhood effect, the zip code effect, the how do you engage in risk sharing to get a neighborhood healthier. And this is going to be, and there's a couple instances that are out there, right, in Tandem in the Philly market, ChenMed down in Florida. There's a lot of these that are now City Block, others that are coming to bear here, and these are really interesting models to look at.
Are they going to address the health disparities by zip code? Is that essentially?
It's basically bringing care to those neighborhoods in unique ways, and a digital platform is one way, but not the only way by far. It really is navigating and getting a sense of what's happening and trying to solve the problem more holistically, not just through the lens of health.
That's interesting.
It's eye-opening stuff. It's not, we're not.
Well,
in that
I'm
space,
aspiring to be a health tech CEO like you someday, and so if nothing else, I like to spread these ideas around.
Oh, they're great ideas.
It's interesting because I come from the health system background, so I have a little bit of a experience bias just because that's where I come from. I may not understand some of the areas more, and what I'm hearing over and over again is more. We need to do more with less. Yeah. Every healthcare organization is running at 110% in the IT space, and then somebody goes, "Hey, let's bring in Quil Health," and they're like, "Oh, that's 115%," because it's another thing to plug in, and I see an opportunity to really change the architecture and how these things are architected, and it's interesting because it's just going to take some courage, and it's going to take some different thinking. It's almost design thinking around how are we doing things and saying, why do we think a platform that was built in the 1980s is going to serve this new technology world that we're sort of entering?
Well, and in no other industry have those platforms then transitioned as those industries have evolved. So if you think about it, right, no one thinks about, hold on, before you can transact with my bank and deposit money, I got to do these 7 things in 3 Citrix hops. And so when we think through this, we have to be able to say, I think the legislation's finally in place. And now the health systems, if they catch up with it, it will make them more efficient, because now there should be security-based standards, there should be security handshakes, we should agree on protocols. I know I'm speaking in nirvana, but this can't be that far away.
It can't be that far away. How is, if you put your hat on, how is healthcare going to change in the next 5 to 10 years? The most.
Yeah, the most.
It's going to change in just about every way, but how is it going to change the most?
I think the consumer wave is here. It's not coming. I think it's here. And I think you have a whole generation coming up that is not engaged in traditional healthcare. And this is where I think the big aha moments are going to happen as the baby boomers age out, and they are very expensive. And now you have an unengaged majority. And so as you're thinking about this, they're looking at care very differently. They're in the highest deductible plans. They're looking for tools that are untraditional. They're not looking at that, I get my 17 copays and my 15 visits. They're not doing any of that stuff. And they need to be. They're trusting their friends.
Do you think they'll start to pay to be healthy? Do you think they'll look at an insurance plan and one insurance plan will say, hey, we'll pay for your care, and another one says, hey, we're going to invest in keeping you healthy. It's interesting. You go to an employer and they say, here's our plan. And so my son's with a pretty sizable firm, and they give him $150 a year to spend on health in any way they want.
Sure.
They buy a digital scale, or they can buy golf clubs.
Yep.
I mean, it's like, hey, just get out and do something. But they also have a whole bunch of other things that say, we are invested in keeping you healthy. Wouldn't it? Do you think we're going to start seeing that sort of transition because the millennials care about being healthy?
They do. I think they care, and they're engaging in their own apps, right? And so they're using non-traditional health apps, and they're also selling their data. They're smart about this. Yeah. They're saying, listen, my data is valuable. There's a cafe I heard in Florida that literally, for exchange for your lunch, you can give them $15 worth of your health data. I'm not kidding. It's a currency now. I forget the name of that. I heard about this on another podcast. But I was like, seriously. So think about that model. There's a whole society of folks that are saying, listen, you're going to get my data anyway. I'm doing everything.
All these people have my data who shouldn't have my data. Yes. Why don't I get some value out of it? I want lunch.
Value out of it. And on the flip side, right, as you're seeing data sets be purchased by big corporations and they're building billion-dollar business off this, why shouldn't people share in that? So there's an interesting change of value and a shift in the economic model, I think, that's going to happen. Fee from service to value-based, and also how do you participate in this new economy?
Well, this is exciting. So how do people follow Quil Health? How do they follow you?
Yeah, quilhealth.com. My Twitter handle is CEdwardSki, because I'm a big ski bum. Just please follow along, and it's been a great conversation.
You're not going to get to ski as much as you have.
No, it's Philly.
Well, you could go to the Poconos, but that's more of an ice skating kind of thing.
Yeah.
Anyway, I grew up skiing in the Poconos, and it really is ice skating because there's so many people on a very small mountain.
On a very small mountain, but they all love what they're doing. So at least
they
they're
do.
Fun.
It is a lot of fun. Thank you again for coming on the show. I really appreciate it.
Thanks for coming to
Philly. Make sure you check in every Friday for more news, information, emerging thought with leaders from across the healthcare industry. And thanks for listening. That's all for now.